Hello, and welcome back to the channel. So today we're going to have a discussion built around some things that are making you sick, possibly. And so we decided, since we're going to include the works of the mechanic shop, and you're wondering, how does the mechanic shop have anything to do with my health or the service place, the car place? We're going to go into that. But as always, like, comment, share, subscribe. It's your public health safe space. And here is where meaningful conversation takes place. And we're going to get to it. Now, there are certain everyday places that have the possibility to make you sick. Now, this is only if there's certain health maintenance that's not done. Now, as always, you know me, I like to start with a hook, so let's get into it, okay? And I might stop and give you a story or say something funny. We're just going to take it as it goes, but we're going to make sure that you get that good information. So let's keep it going, okay? Now, imagine this: a home with mold and pests, a marketplace with contaminated food, or a mechanic shop leaking chemicals into your neighborhood. Now, imagine this isn't just uncomfortable, it's statistically linked to real disease outbreaks across your community, across the US, across the Caribbean, wherever you are, it's linked to outbreaks. Today, we're not just talking about theory. We're going to break down this and we're linking three places while we break this down. We're talking places like New York, Louisiana, and Chicago to show how environments are making people sick. Now, we want to say why the environment equals our health, or why the marketplace or the mechanic shop, how is it linked to our health? Well, we're going to unpack it. According to the World Health Organization, environmental conditions account for over 20%, yes, 20% of disease globally. 20%. Out of that 100, 20% of it. Now, in US cities, they have been doing real-time tracking of this, and so the data is correct. For example, let's take New York City. Dozens of communicable diseases, from foodborne illness to bacterial infections, are tracked and reported every year through the public health surveillance system. Now, the entire data portal exists just to monitor how housing, sanitation, and environment affect health outcomes. This is important to monitor this. This is not just random. We're talking measurable statistics. When homes lack sanitation, ventilation, and cleanliness, disease risk can increase dramatically. This goes without saying. Now, we're looking at diseases like respiratory infections, tuberculosis, E. coli infections, salmonella, rodent-related illnesses. And we know lately they've been talking about rodent-related illnesses. Now, when we look at the real-world information, let's take Chicago. Around 129,000 children have been exposed to lead contaminated drinking water in just Chicago alone because of their aging infrastructure. This lead exposure is directly linked to developmental delays, neurological damage, and long-term chronic illnesses. When we turn around and we look at a place like New York City, that big apple, there is dense housing. Now, with that dense housing, there is shared ventilation systems that contribute to the spread of airborne diseases. In fact, there are infections that are tracked annually by the health department. That's where we get the statistics from. The impact here is not just about discomfort, it's about lifelong health damage starting at home, the place where we lay our head. Now, we can talk about the dirty marketplaces and that outbreak data that is given. Markets can either nourish a community or it can infect the community. We're looking at diseases here like cholera, typhoid fever, hepatitis A, foodborne poisoning outbreaks are just a few. When we talk about New York State, not just the city, but the state, between 2000 and say 2021, 2022, we had 121 waterborne disease outbreaks were recorded. Now, this is according to Newsweek. In the Chicago region, let's say Illinois, but let's just say the Chicago region, nearly 98 waterborne outbreaks were recorded in that same period, 2000 to 2021. Chicago, in specific, their exposure risk was in recreational water. That was linked to about 14 cases of gastrointestinal illnesses per 1,000 people. That's a lot. This means that improper sanitation in food and water systems were leading to repeatable and measurable outbreaks. Now, where we are and what I want to consider, a lot of people never usually consider a mechanic shop, whether it's organized or someone who does their mechanic work in your neighborhood, and especially not the organized place, mostly like where I'm sitting. It can be possibly, but we want to talk about in communities where someone decides, hey, I know how to fix cars, so I'm gonna fix it in my driveway, I'm gonna do it in the backyard. This carries risk. I lived in a neighborhood where we had to report, there was no HOA, there was no homeowners association. It was just community, and we had our neighborhood watch. But we had this new person moved in, and they weren't renting, they bought a home. And this man had a mechanic shop where he worked, but on the weekends and whenever he was off, he still did mechanic work in the driveway. And over time, this created a problem. And the neighbors on either side of him started to complain of rodents. So let's take a look at mechanic shops and toxic exposure. Now, before I continue, yes, we ended up coming together as a community. We had to go downtown and report to the sheriff, told us where we needed to go. And it took some time for him to clean what was needed to get cleaned up. So I'm telling you, if you're seeing this occur in your community, look into it because it becomes a hazard eventually. Now, improperly managed mechanic shops introduce chemical hazards into residential areas. We're looking at diseases like respiratory illness, lead poisoning, cancer risk. Yes, there is a cancer risk, and neurological disorders. Real world data shows us that in places like Louisiana, where environmental exposure creates a hotspot there, the state actively tracks environmental exposure because of strong links between pollution and chronic diseases like cancer and respiratory illness. This comes from the Louisiana Department of Health. Now, environmental research shows that in areas with high waste contamination, there's a correlation with increased cases of E. coli, salmonella, Shigella infections. And what it means for us is that there needs to be more public health advocacy, because when waste like oil, chemicals, heavy metals are improperly handled, you don't just get pollution, you get disease clusters. Now, there are laws and fines and enforcement, and this was what I was telling you. We as a community had to get together to figure out the laws and what we needed to do. So I'm going to discuss that here. Now, of course, these conditions are not just unhealthy, they are enforceable violations. Agencies like the Environmental Protection Agency enforce these penalties, where we have illegal dumping of oil, because you know they do the oil changes. Now, thousands of tens of thousands of dollars accumulate over a year or over a period based on illegal dumping. There are food safety violations, which can lead to immediate shutdowns. There are housing violations where the risk is in your home, which there is legal action that can be taken or forced relocation. Cities like New York and Chicago maintain active disease and surveillance systems to enforce compliance. This comes from New York Health. and their public health system there is really active. Their advocacy to maintain safety is really active in New York. Now, you want to know where do I safely report things? Of course, you can safely report it. Local health department, the code enforcement, the environmental agencies, occupational safety and health management protection are places where you can report violations. These can be done anonymously, online, through online complaint system, or simply using your 311 services in major cities. Now, you're saying, well, I don't want to complain on my neighbor. I don't want to be a bad neighbor. You're not complaining on your neighbor. You're advocating, because sometimes a lot of these mechanics and neighbors, they are not aware of the health risk. So you're advocating for them as well. And this matters. So we have to connect the dots. In Chicago, there were thousands of children who were exposed to lead. In New York, we had over 100 waterborne outbreaks that were tracked. In Louisiana, there's ongoing monitoring of pollution linked to disease. These aren't isolated cases because every city has these conditions. I just chose those 3 cities. They are systemic public health issues tied to the environment. And you know the environment affects our health. So the environment is not neutral. It is either protecting your health or slowly breaking it down. And the data proves it. And so when you see unsafe conditions, I want you to take action. Don't normalize it. Report it, address it, and change it. Advocacy leads to lobbying, leads to changes. Because public health isn't just policy, it's personal. And once it's personal, it can affect anyone and everyone. So from me to you, we're getting smarter. We're opening our perspective or our mindset. You don't have to report something to be a bad neighbor. While reporting, you're advocating for health. And this is what I want you to remember. You are a health advocate within your community. So remember, until we meet again, like, comment, share, subscribe. Also advocate. It was nice talking to you. Go out and make a difference. Enjoy your day.